Want something to drink? No, thanks, I'm okay. Have you thought about the medical courses I suggested? A little. I've done a little research, but I'm having a hard time deciding what I want to do. That's understandable. There's a lot to think about. Is studying medicine the most important consideration for you? Yes and no. The most important thing is probably that I do a medical course of some kind, but not necessarily one that involve a lot of study. Okay, I definitely want a secure job after I finish my course. That is important to me, and I really want to help people. What about location? Do you care about where you study? Not really. That's probably the least important factor. Okay, good. Well, I think we are getting somewhere. You are getting really good marks. Maybe you should consider studying to become a doctor. I'm not sure about that. Really? Why not? Well, I guess another one of my criteria is that the job is very practical. Sorry, but I have to disagree. I think being a doctor is a very practical job. Yes, but if I chose that occupation, I would be studying for so many years and I'd rather not. Maybe you should consider becoming an A&E nurse. Working in the accident and emergency department. I'm looking into that. It's a degree course. You don't sound too keen. If you are not interested in that, what else are you considering? It depends. I'm not sure what I can apply to study. There are few programs where you can study to become a emergency medical technician, an EMT. There are the people who work on ambulances, assessing patients' conditions, performing emergency procedures like applying manual pressure on someone's wounds. After an accident, it also requires some technical knowledge of ambulance equipment. It's professional and practical. It's a tough job, exciting but tough, and very physical. Yes, but it seems like a great way to really help people when they need it. Yes, so what's the difference between the two courses? The EMT course is very practical. When you work in an ambulance, you need a lot of practical skills to help people. You have to be very independent and confident to make decisions on your own. And of course, there's the driver training too. Okay, I see your point. The AE nursing course is also practical, but it includes more the theoretical work, especially when you study the keywords subjects, learning about the human body and about the medicine, and so on. It would involve a body and about medicine, and so on. It would involve a lot more complex study. You have to work closely with hospital staff. It's a degree course, and the EMT course is a diploma course, so it would take a lot less time, and I'd be able to start work quickly. It would be great to actually work after so much study. I've been studying my whole life. I'm ready to do something, have something adventurous, so I'm not too sure about nursing. Yes, I can see that. Continuing with more studying like me isn't for everyone. It may not be the ideal course for you. EMTs need in-depth understanding of how to deal with in emergency, and they need the ability to make quick decisions. I think it would be good at it. And if I wanted to continue my training after working as a basic EMT, I could study to become an EMT specialist. That's another diploma course. But wouldn't you rather study to be a nurse? I imagine the pay will be better. You are probably right, but it's not for me. I definitely wouldn't be studying nursing. Why don't you get some more information about EMT courses then and find out which colleges offer a diploma? That's a great idea. I am going to make a list of colleges this weekend. I guess you made a decision then. You're not going to follow in my footsteps. And this time next year, you will probably be working as an EMT. That's pretty exciting. I think that's really what I want to do.